Hello, my name is Tihomir Georgiev. I am from the Medical University of Varna, and I will present a very brief introduction to Regulation 2017-745. This video is created only for general information. To facilitate the collection and exchange of information, a product identification system is introduced. UDI means Unique Device Identification, and it includes identification of the product itself, such as a model or brand, UDI-DI, but also allows identification of the specific unit, UDI-PI, such identifications being placed on the product itself and on the packing. Products placed on the market must be registered in this system. Not only manufacturers, but also authorized representatives and importers shall be registered in electronic database. There are certain requirements about information provided to the patient. The use of misleading information is prohibited, as well as the lack of information about the risks. If an implant is placed, the patient must receive an information card containing the manufacturer, model, batch and serial number, risk during examinations, etc. For example, in an MRI examination, information about the material of the implant is of great importance. Clinical investigations are part of the overall process. Their purpose is to check if the device is safe and if it has some benefits. It is also required to check whether the device performs as it is designed and expected. There are requirements for testing documentation, how investigation will be performed, the protection of the personal data, the obligation to report adverse events or the possibility of such events related to the device. It is explicitly stated that the place where the clinical trial is conducted must be similar to the place of future use, and that the researcher must be a specialist. Informed consent is a must. Permission from ethics committee is also a must. Duties of the manufacturer do not end with the release to the market. On the contrary, it is necessary for manufacturers not only to draw up a surveillance plan, but also to submit a surveillance report for Class 1 or a safety report for the other classes to be updated periodically. It is also mandatory to report serious incidents, and the deadlines for submitting a report depend on the severity of the event. Manufacturers need to analyze and take action. The authorities can check the products, and if there is a justified need, to withdraw them from the market or destroy them. The regulation also has annexes which describe the safety requirements. Also, the mandatory labeling requirements: name of the product, manufacturer, purpose of the product, batch and serial number, expiry date, etc. The instructions for use, in addition to most of the data on the label, there shall be included indications and counterindications, benefits, side effects, warnings, description of installation and maintenance processes, and many other informations related to the person's safety. The other annexes contain details on the documentation, the notified bodies, the electronic system, the product's classification, the content of the certificates, assessment of the conformity, clinical evaluation investigations, and follow-up. Thank you.